When the Supreme Court overturned Roe v. Wade, we lost the federal right to get in. Since then, more lawmakers and prosecutors have introduced and enforced fetal personhood laws. And that's bad news for pregnant people. Personhood laws use vague language to define an embryo, fetus, or fertilized egg as a person or unborn child with the same rights as you and me. They were first passed to limit access to, but the effects of personhood language don't end there. In states with fetal personhood laws or prosecutors applying personhood principles to existing criminal laws, people who experience pregnancy loss or do anything to affect their pregnancy or birth outcome, like having, can be charged with a crime. A recent study by Pregnancy Justice, an advocacy organization that defends the civil and human rights of pregnant people, found that in the first year after we lost the federal right to, there were at least 210 cases charging pregnant people with crimes related to pregnancy, pregnancy loss, or birth, even if they hadn't done anything illegal. This was the highest number of pregnancy-related prosecutions documented in a single year, and the majority of defendants were people with low incomes. Pregnancy-related criminal allegations can be anything from alleged substance use, including using legal medication prescribed by a doctor, to failure to seek help during or after birth, and even failing to report giving birth at all. One woman's lack of access to prenatal care was used as evidence of a crime, allegedly endangering her pregnancy while she was incarcerated. This woman had written to a judge requesting a transfer to a treatment facility, but was ultimately denied. 3 women were even charged after researching or exploring the possibility of getting in. The mere act of trying to get information about led to criminal charges. Free country? Where? Despite the fact that prenatal care is not accessible for many families, especially those who live in maternity care deserts, areas with little to no obstetric care centers or providers, 15 women faced criminal charges that included allegations that they didn't receive prenatal care. But wait, there's more. Application of these personhood law principles could mean pregnant people who have miscarriages can face unaliving charges. Even though miscarriages are by definition spontaneous, and even though 10 to 20% of known pregnancies end in miscarriage, a number that's likely higher because most people experience miscarriages before they even know that they're pregnant, people have faced unaliving charges for that. Pregnancy criminalization would not exist without the concept of fetal personhood. Period. To be clear, pregnancy criminalization and personhood are not new. Policymakers and prosecutors have been furthering personhood laws and criminalizing pregnant people since well before Dobbs. But we can't ignore the fact that the 2022 decision to overturn Roe v. Wade, which allowed states to ban, is a huge reason that so many more pregnant women, new mothers, and women who endured miscarriages, stillbirths, and other trauma are being punished, threatened, imprisoned, and separated from their families due to matters outside of their control. In most of the pregnancy criminalization cases that occurred the year after Dobbs, there was no evidence or data that proved the fetus was harmed. In fact, over 191 cases didn't require proof at all. Instead, they were charged based on whether or not police and prosecutors believed pregnant people exposed their pregnancy to a risk, not based on a medical provider's assessment of a risk. States with the most cases of pregnancy criminalization are also states with some of the worst maternal and infant health outcomes. And they rank the lowest in healthcare quality overall. And rather than investing in their healthcare systems or other institutions that contribute to these outcomes or making care more accessible to improve these outcomes, policymakers have instead chosen to prosecute and punish pregnant people. The harsh sentences faced in pregnancy criminalization cases and the refusal of these states to make steps to improve maternal and infant health outcomes just proves that their goal isn't to protect life from harm at all. Charging pregnant people with crimes is just another way to control our bodies by taking away our power to make our own healthcare decisions. Now let's circle back to Roe v. Wade to connect the dots. It is no leap to say the rise in criminal charges against pregnant people haven't been influenced by the Dobbs decision, even though related charges only make up a fraction of the alleged crimes. Hear me out. In the Dobbs decision, which overturned Roe v. Wade and our federal right to, Justice Alito's intentional use of the words unborn human being is a clear nod to personhood concepts. The devastating loss of our federal right to, and this nod to personhood by Justice Alito to describe fetuses, laid the groundwork for policymakers to pass or enforce even more fetal personhood laws.